The lingering legacy of a deadly virus.
Vivify Studio Stories.
1, 2, 3, 4.
In a small town of Harmonyville, deadly virus struck, leaving a lasting impact on the community. The virus spread rapidly, claiming the lives of many residents and turning the once vibrant town into a ghostly silence. The lingering legacy of this deadly virus would shape the town's future in unexpected ways. As the virus took its toll, fear gripped the hearts of those who were fortunate enough to survive. Families were torn apart, friendship shattered, and hope seemed distant. The townspeople lived in constant dread, afraid of the virus, unpredictability. Many fled Harmonyville while those who stayed vowed to rebuild their beloved town from the ashes. The virus was highly contagious and had a terrifyingly high mortality rate, causing panic and chaos among the townsfolk. The streets that once bustled with laughter and chatter were now barren as people locked themselves indoors, desperate to avoid any interaction that could potentially lead to exposure. At first, it seemed like an ordinary flu, causing coughs, fevers and body aches. However, as days went by, the symptoms worst, person leaving the doctors baffled and the townspeople terrified. As the virus rapidly spread, panic and chaos ensued. The local hospitals became overwhelmed with patients. Days turned into weeks, and the town was gripped by fear and uncertainty. People were afraid to leave their homes, and every cough or sneeze sent them into a frenzy. It was as if a dark cloud had descended upon them, threatening their every existence. The virus ignited panic in the hearts of inhabitants. The local authorities, perplexed and overwhelmed, were desperately seeking answers to combat this mysterious and rapidly spreading illness. The virus painted a grim picture, with its alarming death toll rising exponentially. The tight-knit community was soon consumed by grief and desperation as families lost loved ones and hospitals overflowed with the sick. Terror gripped the town as the virus showed no mercy. Spreading like an uncontrollable wildfire, the local authority swiftly enacted emergency measures to control the outbreak, imposing strict quarantines and isolating the infected from the healthy. Schools were closed, businesses shut down, and strict curfew was implemented. The once vibrant town turned into a ghost town, with only eerie silence echoing through the empty streets while the townspeople complied with the government directives. Fear and uncertainty loomed large in Harmonyville. Families isolated themselves within home, taking every precaution to protect their loved ones. The mayor and the local authorities organized a group of brave volunteers to provide essential supplies and medical care to those in need. The doctors and nurses struggled desperately to control the situation, but the elusive nature of the disease left them grasping for answers. News of the outbreak spread across social media platforms, in newspapers and on television, sending shockwaves of panic throughout the country. The town, once peaceful now, was going through a time of uncertainty and desperation. Every single person was falling prey to this deadly virus. Not even a single home was left that was not affected by this outbreak. People of the town had lost all hope, and some even predicted that Armageddon had arrived and soon the whole of the world would come under the influence of this deadly disease. The disease started with a few isolated cases that soon evolved into a full-blown epidemic that left doctors baffled. Health authorities struggle to understand the nature of the virus as it evades detection, constantly changing its symptoms and transmission methods. Months passed, and as the virus continued to wreak havoc, the scientists tirelessly experimented, tested, hypothesized, trying to find an antidote for the virus. The virus spread rapidly, affecting people of all ages and backgrounds. Fear and tension permeated the air, disrupting the once vibrant community spirit. People learned to adapt to this dream reality. They wore masks not as a fashion statement, but as a means of survival. They avoided crowds, choosing to remain in isolation, praying to escape the grasp of this malevolent virus. The fear in their eyes was palpable. As they wondered whether mankind's days were numbered, the government had collapsed and lawlessness reigned. Society was fragmented into small groups struggling to survive amidst the desolation with limited resources and dwelling supplies. Desperation filled the air, giving birth to a new era of hardship and suffering. An outburst of a deadly virus had swiped across the globe, leaving chaos and despair in its wake. The once bustling city now lay abandoned, overrun by plants and decay. People scurried in fear, hiding in the remnants of the world they once called home. No one knew where the virus had come from and how it had been released. All that was known was that it was deadly. People were dropping like flies and the death toll was rising. The virus had no mercy. It didn't discriminate between young and old, rich or poor. Everyone was at risk. The world was in a state of panic. People were afraid to leave their homes, and many countries have closed their borders in a desperate attempt to contain the virus. Despite governments' best attempt to contain the virus was too powerful and killed hundreds of people. Before it was finally contained, the government appealed for donations from all over the world to save Harmonyville from this deadly outburst. And first, only Harmonyville was under the influence of this deadly virus. But now the virus was slowly spreading its tentacles to other parts of the world. The whole world was in a state of havoc. The local doctors and scientists worked tirelessly to understand and compact the virus, but their efforts were in vain. The contingent rapidly multiplied, affecting everyone. I encountered schools, businesses and public places closed their doors to prevent further transmission, leaving the town in a state of despair. Doctors, nurses and volunteers worked tirelessly defying their own well-being to save as many lives as possible. Elsewhere, scientists and researchers raced against time to understand the mysterious virus. News outlets amplified the urgency, alerting neighboring cities and nations about the dire situation. Responses poured in and teams of medical professionals were dispatched to assist the afflicted town as the virus continued its relentless march. Affecting more and more individuals, the town turned into a ghostly shell of its former self. Abandoned streets and closed shops spoke volumes of the fear and anguish that permeated the hearts of the townspeople. Amidst the chaos, tales of resilience and courage emerged. Neighbors came together, offering support to one another in unimaginable ways. Volunteers organized food drives, ensuring no one went hungry. Teachers rallied to tutor children through video calls, determined to keep the spirit of education alive. Artists and musicians created virtual performances, providing solace to those confined within their homes. The community's faith began to waver as weeks turned into months and hope seemed to fade away. The once tight-knit town found itself bitterly divided as fear and desperation seeped into every crevice. People became suspicious of each other, unwilling to lend a helping hand for fear of getting infected themselves. However, amidst the darkness, rays of hope flickered as the government refused to succumb to despair. The government began organizing support groups, encouraging people to come together despite the circumstances. Unity and compassion were the only weapons they had against this deadly virus. Slowly but surely, the positive spirit started to touch. The hearts of many people began to rekindle their bonds, utilizing that only by working together could they find a way out of this nightmare. They formed volunteer teams to deliver essential supplies, support those who were sick and offer each other emotional strength as the news of the deadly virus spread across the world. It also reached out to the neighboring town of Harmonyville. Dr. Emma Collins, a brilliant scientist who lived in the neighboring town. When the news of the outbreak reached her laboratory, she knew she could not stand idle as countless lives were lost. Emma Collins rose as humanity's last hope. Dr. Collins gathered a team of talented scientists, medical professionals and experts from various fields. Determined, they pooled their resources and embarked on a race against time to save humanity from annihilation. Her first challenge was to uncover the virus origin. Digging deep into epidemiological reports, genetic databases and global surveillance systems, they unravel a shocking truth. The virus was artificially engineered, purposefully released to destabilize the society. Armed with this knowledge, their battle took a new turn. Now, not only did they strive to find a cure, but they also aimed to expose the sinister forces behind the virus. The team worked tirelessly, collecting data, analyzing tissue samples and conducting extensive experiments. Days melded into nights as Dr. Collins' team toiled relentlessly in their underground laboratory. They faced various setbacks, failed attempts, unforeseen side effects, and increasing dispersal of the virus across the globe. With each passing day, more lives were claimed and hope diminished. In their darkest hour, Dr. Collins had a breakthrough. After tirelessly evaluating different compounds and pharmaceutical combinations, a glimmer of hope emerges. A potential treatment. However, it was nothing solid, merely a promise lead that needed further refinement and testing. With time running out, Dr. Collins made the bold decision to administer the experimental treatment on herself. Harnessing her knowledge, she became the first subject to test the potential cure. Undeterred by fear or doubt, she pressed on, hoping against all odds that this would be the solution humanity so desperately needed. Miraculously, the treatment suppressed the virus within the Dr. Collins system. It was a momentous victory, both personally and scientifically. In light of the success, Dr. Collins and her team redefined the treatment further, until it became a variable antidote for the virus. Meanwhile, they had also made considerable progress in unraveling the conspiracy. Their investigation led to a clandestine organization seeking global dominance through orchestrated pandemic. Armed with evidence and their newly developed antidote, they work with intelligence agencies to expose the culprits while coordinating a worldwide distribution of their cure. The battle reached its climax as Dr. Collins and her team confronted the organization leaders in a dramatic showdown. Utilizing their expertise and wits, they outmaneuvered their adversaries, revealing the truth to the world in one fell swoop. They not only saved millions of lives, but also brought justice to those responsible for the devastating virus. Dr. Emma Collins emerges as a symbol of hope and resilience, a beacon of light in humanity's darkest hours. The virus that once threatened to annihilate civilization was defeated through her passion, dedication, and unwavering determination. As the world healed, Dr. Collins and her team continued their tireless efforts, ensuring that no virus would ever again hold humanity hostage. Hey there, beautiful bookworms, don't forget to like and subscribe to our channel. Your liking helps this channel a lot. Have a great good night's sleep.